Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 14 additional deaths due to COVID-19. This includes a male in his 50s from the Winnipeg Health Region, a male in his 50s from the Winnipeg Health Region, a male in his 70s from Interlake Eastern Health Region, a female in her 70s from the Winnipeg Health Region linked to the outbreak at House Science Centre GD4, a female in her 80s from the Winnipeg Health Region, a female in her 80s from the Winnipeg Health Region linked to the outbreak at Holy Family Personal Care Home, a female in her 80s from Winnipeg Health Region linked to the outbreak at Holy Family Personal Care Home, a male in his 80s from Winnipeg Health Region, a female in her 80s from the Winnipeg Health Region linked to the outbreak at Charleswood Care Centre, a female in her 90s from the Winnipeg Health Region linked to the outbreak at Saul and Clarabelle Simpkin Centre, a female in her 90s from the Winnipeg Health Region linked to the outbreak at Bethania Mennonite Personal Care Home, a male in his 90s from Southern Health Santé Sud Health Region linked to the outbreak at Rest Haven Nursing Home, a male in his 90s from the Winnipeg Health Region, and a female in her 100s from Southern Health Santé Sud linked to the outbreak at Villa Youville Personal Care Home. I want to extend my condolences to their family, to their loved ones, to their caregivers. Our current 5-day test positivity rate is 13.8% provincially, 13.2% in Winnipeg. 447 new cases of the virus have been identified as of 9:30 a.m., taking our lab confirmed cases in Manitoba to 20,392. Have some data to share, and this data showing that from the beginning of the pandemic, about 7.5% or 2 of 25 people who get COVID-19 experience a severe outcome. And that includes a hospitalization, ICU admission, and death. We're certainly at a much different place at this stage than when we were at the initial wave. We've seen our death rate increase by more than 9 times since Thanksgiving. The rate of hospitalization is also much higher than it was at the beginning. We're also seeing COVID hit our First Nation communities. And this is our First Nation communities, both urban and rural. In October, we had no COVID-19 fatalities in our First Nations people. Now more than 1 in 10 of the daily reported deaths are in First Nations people. In October, 1 in 10 of the cases were in First Nations. Now it's more than 3 in 10. About half of the current hospitalizations are First Nations people. And this all continues to support our message that we need to bring these cases down. We need to be on our guards during this holiday season. We have a lot of this virus circulating right now. And we're at risk of escalating transmission if we let our guards down, if we visit and socialize during these holidays. We've had a lot of questions related to students who may be living away from home that are attending school. So the overall message from us is the same. Non-essential travel is not recommended. And so that includes traveling to visit over the holidays, both traveling outside of Manitoba to visit others or have people return to Manitoba to travel. We still have self-isolation restrictions in place for anyone entering Manitoba from east of Terrace Bay. And essentially we're advising everyone to stay home as much as possible. So there are situations where students may be within the province or out of the province in living situations such as residencies that may not be available over the winter and do plan to travel home. This traveling back to your essentially original residence with your parents is not a violation of the orders. So when that's necessary, it certainly doesn't violate the orders. But again, our message is to reduce the amount of gathering or socialization outside of your household. So we realize there's situations where this will occur. We want to advise to do that safely to ensure people are self-isolating appropriately if required to, and that means not being in close contact with anyone else in the house. Otherwise, all of the typical fundamentals should apply. So the overall message is to limit our gathering, especially this upcoming season, to those within our household. There are exemptions, and even within those exemptions, we have caution to ensure we're reducing amount of contacts. We have this glimmer of hope with a vaccine arriving as soon as next week. We know that next holiday season is going to look much different than this holiday season, but we have to stay safe right now. We have to be able to get through these holiday seasons without escalating the transmission of this virus. Our hospitals are still under immense pressure. ICUs are under immense pressure. We need to cut our contacts down. So other type of things that we're hearing are plans to get children from multiple households together over the holidays, and one of the thoughts there was that they're in the same cohort at school anyway, so we'll still try to get them together. Our advice is really clear. Socialize only within your household. We're really at this critical time. So certainly this is not allowable under the orders to visit your residence in these circumstances. If gathering outdoors for activity, keep those group sizes under 5. And so it's quite clear these are quite tough, and it's even tougher during the holiday season. But we have to stay on guard. We can't let our guards down and have a lot of socialization over these holiday seasons, or we're going to see these spikes of numbers into the new year. People are planning some, creative ways to share meals, dropping meals off at family members' house. Certainly do so safely, but we can't gather for large meals this year with family members outside of our household. Please do so virtually this year. Again, we do have a great deal of optimism that next year is going to look much different than where we are right now. But this year we still have to maintain our focus. We need to stay home. Our ICU numbers, hospital numbers are just too high at this point. So stay home, don't go out unless it's absolutely necessary. Find creative ways to stay in touch. Please reach out virtually to loved ones. But right now we need to focus on staying home through this season. I know that's difficult, but it's absolutely necessary. So thanks. I'm going to pass it over to Lanette.
Thank you. Good afternoon, everyone. We continue to see COVID-related admissions coming into hospital, which places increased stress on our staff as well as the health system as a whole. Earlier this week, we told you about the work that's happening behind the scenes to refine our data so that it's a more accurate picture of the active cases and the viral related hospitalizations that are occurring. And this work has continued over the past few days. We've broadened our scope of COVID hospitalization data now to include individuals who are no longer considered infectious, but still very much in need of inpatient services due to the impacts of the virus. As of this morning, there are 388 individuals hospitalized related to COVID. 298 of those COVID patients are considered still in that infectious phase of the virus. And there's also 90 COVID patients who are past the infectious stage, but still requiring that inpatient care. Meanwhile, in our critical care program, they are currently at 168% of their pre-COVID baseline as of this morning. There are 121 patients who are in the ICUs today, and this includes 40 patients who are considered active COVID patients, infectious, as well as 13 longer-term patients who we would say are past the COVID infectious stage, but still very sick and requiring critical care. 48 of the 78 patients on ventilators this morning have or had COVID-19, and this includes 8 of the 13 long-term patients who are no longer infectious. The improvement in the quality of the data we report gives a more precise portrait of what's happening in our hospitals. We know this virus can and has impacted Manitobans of all ages, and what this data shows us is that a significant portion of people who are hospitalized with COVID have lengthy stays that outlast their infectious period. High daily case counts result in a disproportionate number of long-term patients, which interrupts our normal patient flow in our hospitals and also contributes to significant stress in the health system that our staff are feeling, and others whose services have been decreased or delayed are also feeling. So this is another reason why we need to do all that we can to mitigate the risk and the exposure of this virus. Public Health is reporting 14 COVID outbreaks in 9 hospitals throughout Manitoba. They are also reporting outbreaks at 52 care homes throughout the province. And these outbreaks, as stated previously, include 1 resident or staff at minimum. That signals to us we need to have a close watch and implement all the outbreak protocols in place with the effort to try and mitigate further spread of the virus in the care homes. Paramedics are continuing to support as needed. They are at Fairview and Grandview care homes in the Prairie Mountain region as required. As well, the Canadian Red Cross is also continuing to provide assistance to staff at various sites. Our isolation center program continues to be extremely busy at this moment, particularly here in Winnipeg, where the city's shelter population has increasingly needed a safe place to isolate due to being exposed or testing positive for the virus. We currently have a total of 250 individuals in isolation at 15 different sites across the province. In Winnipeg, 2 of the 3 designated shelter sites have remained at its current capacity with 52 rooms that are in use. The 3rd most recently opened shelter site had 14 rooms in use last night, and they have the ability to scale up to 138 rooms as needed. So that would be an incremental, we would increase the supply as the demand requires. The Red Cross site, which is also in Winnipeg, had 57 of their 90 rooms that are in use, and 62 of the 70 rooms that are in the Winnipeg hotel isolation site were occupied. And our northern programs had 47 rooms in use at multiple sites in various communities. So we are continuing to expand that isolation capacity for those who need a safe space to isolate. In addition, participants in the isolation program, we have built in the supports that they require, including daily health checks, online consultations with primary care providers and specialists, as well as occasional on-site visits from our paramedic partners. We are working to provide more staffing to further expand the range of supports that are available to these clients in the days ahead. And finally, just a quick reminder, the mobile testing site at 1181 Portage Avenue in Winnipeg will permanently close at the end of today. This will be replaced by a new walk-in testing center at the Garrick Center downtown, which is going to open on Monday to serve Winnipeg's downtown population. The hours of operation at the Garrick site will be daily from 8 a.m. to 4 p.m. And with that, we can open up the line to questions.
Thank you. A reminder to our reporters on the phone, you will have one preliminary and two follow-up questions this afternoon. Up first, from Global, Alicia.
Good afternoon, folks. Recoveries took a big jump over the weekend, as reflected in the data, but now it's gone back to about 300 recoveries reported daily. Are we still in a backlog, or is that just what it is now?
Yeah, so there was certainly that large jump that you mentioned, and that was largely due to our technological advancements with being able to close our files. So I think as far as closing cases go, we're still overestimating the active cases. There's still cases that are recovered that aren't quite closed yet, but that's something that will continue to be improved over time.
Okay. We heard from a nurse in Steinbach that the hospital has reached capacity and that there are no beds in the ICU. Can you tell us what the situation is there?
Steinbach, I do not believe has an ICU. Are you referring to ICU beds in the entire system?
No, that's just the question I was asking. Hold on. Sorry, I've got here, no beds are available. Oh, sorry, one unit was filled with COVID patients, and one unit isn't filled with COVID patients while they have two full units that are COVID patients, and that there are no beds available. Sorry, my apologies.
That's okay. So what I would say to that is it happens fairly regularly on a normal basis that our hospitals do get full, congested, and protocols are in place where if we have to discharge or transfer or escalate the issues to the regional team, they will support what needs to be happening at the site. So it really depends on, it's hard to give you any specifics, but in general, if there are patients, I don't doubt that they are full in the hospital. What has to happen is we need to assess the patients, their acuity level. Are they in the right place? Do some of them need higher level care? Do some of them maybe can be transferred to a lower acuity site, a community site, or somewhere close by, but still get the care that they receive? So it's not uncommon for that to happen, and there are protocols in place. So I would say that the Southern Health Santa Sud Regional Health Authority will be working with the site to problem solve and manage the flow of the patients.
Thank you. For my final follow-up, I've noticed that the school exposures, any exposures, have not been updated on the website for almost a week now. Is there a reason behind that?
Not a public health reason. We can look into it and see why that's not updated.
From the Brandon Sun, Michelle.
Good afternoon. All about the readers today. First question, why is it okay to meet my son and daughter-in-law in a public outdoor park for a visit, respecting social distancing, but not in my own yard where we feel much safer? We can sit in our yard 6 feet apart, just the four of us, the same as meeting on the street or in a park. This makes absolutely no sense. As a responsible, law-abiding adult, can we not be trusted in our own yard?
So here's the thing: is when we write these orders, they're written broadly, right? They have to be written broadly. They're written at a time when our ICUs are full, our hospitals are seeing increased demand. So we had to make very stringent restrictions because we had no choice but to bring these numbers down. Probably at every single circumstance of these public health orders, you can find individual circumstances that might not make perfect sense. But we can't write orders based on everyone's individual circumstances. So when we had the residence restrictions, we didn't want large gatherings in people's homes. People going out for recreation, being active, we certainly want to encourage that. But we didn't want large gatherings, be it in someone's home or in their yard. Now you can give, I'm sure, multiple examples over multiple sections in the order that you can find certain circumstances that don't quite fit. We just can't draft orders in that manner. So right now, we're at a critical time. So I think that's what we should focus on, how critical it is that we bring down these numbers, and that it is a challenge for people. We've never said anything other than that. But right now, we're just such at a critical spot. Our focus should be on reducing our contacts and bringing down these numbers.
Thank you. Second question, again from a reader. I heard that the NHL is attempting to jump the queue and purchase vaccines so the players can be vaccinated ahead of everyone else. This is concerning. So I guess some sense of whether this could possibly be true or not.
I'm not aware of that in any respect. I haven't heard any discussions in that manner.
Okay, thank you. So following from my first question, and I know you've addressed this a bit, I don't want to make you repeat yourself too much, but we are receiving an extraordinary number of questions dealing very specific scenarios from people eager to do the right thing. So for example, a grandmother who babysits her grandchildren, has daily contact with the children and the parents, wonders if they can also spend Christmas together. Now, I also understand that enforcement has had 4,270 tips. You often speak of balance. Do you think the tip line is having a deleterious effect on the population to the point where they're having a hard time making balanced decisions on their own out of fear? And can you offer an unequivocal statement that might help people make sound decisions?
And I think that this is, part of that. I think they mentioned balance there, and I think that's absolutely right. And our approach has been incremental. So we really did try with just messaging and having people make decisions that would be fitting with the fundamentals, and it didn't work for us. We needed to progressively raise the restriction level because our numbers continued to go. And you recall that our first red restrictions kept the group sizes at 5 for these kind of reasons, that people could make some rational decisions that might work out for their individual circumstances. But at the time, that was met with a lot of questions on our method of still allowing the group size of 5. So then we had to go further black and white. And now we're at a stage where, I'm sure you can find numerous one-off decisions that probably would be just fine. But we've come to a point where we needed black and white orders, and so with that will come certain circumstances that may not be exactly as we intended. As far as the line to call others, so again, it is that balance. We did not want to be in a situation where neighbors are calling on reporting neighbors because they have one car in their driveway. And that again was addressed with the group size limit. But we were called on to make black and white orders, and so now that will have some of those circumstances. So my thought is be kind. We do want to get through this holiday season. We know it's going to be difficult. We know there are exemptions in those orders for many aspects. And we want them to be used wisely. We want people to gather wisely and ensure that we're not increasing our contacts over this holiday season unnecessarily, because we just know that will lead to increase in cases. So it's a challenging time, challenging restrictions, sometimes more challenging to some than others, but know that we are in a very critical spot right now. And these orders are absolutely necessary.
From CJOB, Clay.
Good afternoon, everyone. Dr. Roussin, Manitoba, we went into code red November the 12th. So we're looking at about a month now. 298 cases reported yesterday, 447 new cases today. Assuming that the majority of the folks in our province are following the restrictions, when should we start seeing these numbers come down?
Yeah, and so we've, if you compare it to the trajectory we were on, we have seen the numbers come down, right? We've dramatically changed the trajectory that we were on, and absolutely not to a level that we want. Today's numbers, we have to be cautious to interpret, single day jumps like this, especially as a lot of today's numbers are confirmation tests from the rapid tests in some of the northern communities. But nonetheless, we want these numbers to come down. We have very strict restrictions right now going into a very difficult season to further adhere to them. But what we know is that if we stay home, if we limit the amount of contacts, then there's no choice but for these numbers to go down. So if we have adherence to our orders, we're going to see these numbers come down. So that's it's so essential that we stay focused during this holiday season. We have vaccine in our jurisdiction as early as next week. We know that many months from now things are going to look much different, but right now we have to stay focused.
Second question, and again to Dr. Roussin, when you break down the various neighborhoods in Winnipeg, is downtown Winnipeg considered the hot spot when it comes to the number of cases, the downtown core, and if so, why?
Well, we are seeing the downtown Point Douglas region. We're seeing increased activity in Seven Oaks as well, but downtown and Point Douglas are the highest. And we know that with this virus, like so many health issues, there's a disproportionate effect to those in the lower income quintiles. And we're seeing that with this virus as well. So the crowded housing, homelessness, sheltered population has been disproportionately affected, and we know there's a disproportionate numbers in those community areas.
Okay, and final question, sir. A few weeks ago, you mentioned Steinbach's positivity rate, and a lot of people were shocked when it was at 40. Where does it stand as we head into the weekend?
It's all of Southern Health has their numbers have increased since these last number of weeks. The positivity rate now in the Steinbach region is around 30% or just below, so it has made a difference. We're still seeing cases there, but absolute cases, test positivity are coming down in Steinbach, as well as in other areas in Southern Health.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Scott Billick, Winnipeg Sun. Dr. Roussin, you mentioned kind of that Northern Health surge of cases. So you're saying those are all from rapid testing and they're just confirmed through the CADM lab now. But where are these just more outbreaks, or these outbreaks that have already been declared? Where are the cases, I guess, coming from up north?
Yeah, so the hardest hit community right now is Shamattawa, and that was over 100 of those cases were from Shamattawa confirmation tests. So they're certainly dealing with a significant outbreak.
Thank you for that. Second question, I'll jump back to the one that was asked about the Jets or just the NHL jumping the queue. I assume if they were to buy their own vaccines, I'm guessing the province wouldn't sell the Jets vaccines. Would those be sourced from other private places, whether they deal with Pfizer or whoever directly? Is that how that would work, or would the province provide them for a fee to an NHL team?
We would not, with the scarcity of the vaccine supply that we're getting, we would not be involved in selling vaccine to anyone privately. We're going to follow our prioritization numbers. So I don't have any knowledge of them going about this way or how they would.
Okay, thanks for that. And just my final one. You were on, I believe you're on CBC this morning, CBC Radio, saying that most Manitobans, that is, will be vaccinated, close to the middle of next year, June, July kind of area. Would if that is the case, would sporting events then, like, I know the Bombers or the CFL is planning to have a season this year. Would fans be allowed back into stadiums at that point if most people are vaccinated by kind of mid-year?
It's really early to tell. I think that if things work the way we want, that early fall, we would have, every Manitoban would have the opportunity to be vaccinated if they so choose. Our approach is to have these restrictions in place for the least restrictive duration. Now, very large group events will probably be sort of one of the last restrictions in place. So really hard to speculate where we'll be at. But if things go anywhere near what we're anticipating, we're going to be in a much better place this time next year.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. I had a question about the code red situation. What numbers do you consider and do you monitor to say it's worth it to lift some restrictions or not?
Yeah, and so there's a number of indicators that we've been following from the beginning. When we're well established into the second wave like this, the absolute case numbers are fairly good to follow because we know that about 4 or 5% of those lead to hospital admissions, 1 to 2% ICU admissions, and roughly 2% in deaths. And so we can make a lot of predictions based on just the average number of cases we're seeing a day. And so we look at the test positivity, we look at all those indicators, we look at our healthcare system capacity. And then it's also important to remember that our healthcare system capacity isn't just about COVID. We have a number of elective procedures that have to be delayed because of the response to COVID. So there's a lot of reasons why we need to get these COVID numbers down, these admission numbers down, so we can get back to healthcare for everyone who needs it.
Thank you. And my second question, I guess it's for Lanette Siragusa. I was wondering, you say that there is 52 personal care homes dealing with COVID-19 today. Is it 52 personal care home or 52 just closure?
52 personal care homes out of, I think we have 125 licensed personal care homes in the province. So they are based on the site, not necessarily on a unit, but yeah.
Thank you. And my last question is, we are in code red since 1 month now. Why are we seeing new COVID-19s in personal care homes and hospitals? What is the main reason?
Well, I think that we're in the code red for sure, and we've managed to change the trajectory of climb, but we're still seeing community-based transmission. We're still seeing test positivity rates at 13%, and unfortunately, that means increased risk in all settings. And so we've had a number of procedures in place really from the beginning. To try to do what we can to protect the introduction of that virus into personal care homes, but what we've seen in this wave, those have been challenged. So we're going to continue to work along with that sector, along with the public health approach, just to bring down the community-based transmission. But we need everyone to continue their efforts to minimize the transmission of that virus, as well as doing whatever we can to stop the introduction of that virus into these facilities.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. The National Advisory Committee on Immunization recommends giving the vaccine to care home residents first. So why is Manitoba doing critical care workers first?
So there's a couple of things. So this initial shipment, one of the requirements of this initial shipment that we're receiving, hopefully by next week, is that it must be administered at the point of receipt. So there isn't an opportunity to take that to a personal care home otherwise. So that's just the requirements of this very early, relatively low doses. And then as we roll out, the residents of personal care homes will be included as we get more and more doses as we deal with the logistics. So they're certainly in our high priority group.
Okay, thanks for that. Questions number 2. So in the order today, it says you can practice your hockey skills or engage in casual play, but it also says you can't skate within 2 meters of anyone outside your home. So is this to mean that you can actually play hockey casually with somebody outside your home, but no other form of skating? Can you? This isn't the case of the order. The order was just written this way. Can you please clarify if you can play hockey with fewer than 5 people outside that are not in your home?
Yeah, and so this is a difficulty when you write these orders that they have to be black and white. So we said skating, and then we didn't want somehow it to be interpreted that, well, you could skate, but if you were holding a stick, then you were no longer in the order. So we want to make it clear that skating included skills of hockey or ringette or what have you, and then so outdoors the group sizes are 5. And so, certainly the household, and if the household is more than 5, then obviously you can, group outside without that. But otherwise, the group limit applies. It's groups of 5. So we didn't want organized play. So even in small group sizes, we don't want organized practice. We just want people to be out and about and find ways to be active safely.
Thanks for that. The big picture, and you kind of answered this earlier, but as of yesterday, the 7-day average case count was 314. Today, we're up in the middle of the 400s range again, and not just seeing big case counts up north. We know about Shamattawa. We're seeing higher numbers in Prairie Mountain and elsewhere. I know things fluctuate day to day, but you guys are tracking metrics behind the scenes in a more sophisticated manner than anyone. What can you tell me, based on your tracking the last 2 weeks, of where we're going in the next week here? Should we really worried about today's count, or is this purely an anomaly?
So if we plot the cases and look at our modeling data, we are seeing that trend very slowly down. And so that trend overall continues, not at the pace that we're expecting, not at the pace that we need. And so, of course, we'll continue to watch these numbers closely. But up to now, excluding today's increase, we do have that sort of downward trajectory.
From the Canadian Press, Kelly.
Kelly Malone, the Canadian Press. So considering the disproportionate impact second wave is having within the First Nations population on and off reserve, how are strategies changing when it comes to public messaging or public health in general, especially considering some of these populations might not get information, say, from the news or these briefings?
Yeah, and so there was a lot of collaboration, a lot of preparations with First Nations leadership before even the first wave came, and all throughout this. So there's been a lot of work, a lot of leadership at the community level. A lot of collaboration through Manitoba Health, Public Health, First Nations Indian Health Branch, and various leaders. And so that's where a lot of the work is being done. Of course, there's also the disproportionate effects in, say, the downtown and Point Douglas area, which also disproportionately affects urban Indigenous people. And so there are various levels of work being done there, engagement with community partners. We are moving one of the test sites to the Garrick to be able to have that walk-in capability and increased access to testing there. Lanette spoke about the alternate isolation accommodations as well. So there's a lot of work being done, but there is absolutely, we're seeing that disproportionate effect here.
And Dr. Roussin, you say that 7.5% of people who get COVID have a severe outcome in Manitoba, hospitalizations, ICU, or death. So where does this stand when we look at other regions in Canada? Is this higher, lower, on par?
We'll see like that our ICU and hospital admissions are fairly on par in both waves through Canada. We can see right now, because of how hard our personal care homes have been hit in this second wave, and in November, that our case fatality rate is amongst the highest, just because of the disproportionate effect we're seeing in the elderly populations in those communities. But the other severe outcomes were fairly on par.
And moving on to vaccines, can you say whether Manitoba is actually prioritizing the Moderna vaccine over the Pfizer vaccine? And if people are looking at the numbers, they might see that we're getting a lower amount of this original wave of the vaccine than Saskatchewan. But can you explain why Manitoba might prioritize the Moderna vaccine over Pfizer, if that is the case?
That's not really the case. The distribution of these vaccines are procured nationally and distributed through collaboration of the provincial, territorial governments and the federal government. What we find is that the Pfizer vaccine right now has much more logistical challenges. Needs to be stored at -80, which makes it very difficult to get it to some remote settings. The Moderna vaccine, while also quite logistically challenging, is much less so than the Pfizer. And so as we get more Moderna vaccine, that's where we're planning on being able to distribute that vaccine much more readily in say, northern and isolated communities.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV. I have some questions about home care. Have any cases or deaths been linked to home care? And are home care staff going from, let's say, a 55-plus resident and also working at a long-term care home?
I would have to ask the regional health authorities. I don't have that data available to me, but it may be the fact that they are going from a 55 plus to a personal care home if they were redeployed, and that may be a fact. We do have the one site model, which restricts people from going from PCH to PCH to PCH. And if there's any exemptions that are required, we are advised by the region to public health, and we will look at the considerations of the situation. But in terms of people who have been impacted by home care, I can look into that for you. Specifically, are you interested in Winnipeg or provincial stats, Michelle?
Probably provincial.
We'll see what we can find and get back to you.
Okay, thank you. This one's for Dr. Roussin. What's your reaction to the Justice Centre's legal challenge against the Code Red restrictions?
Yeah, I won't comment on anything that might be, going through the courts. I mean, I think that's not specific to that or any challenges, through the court system. I would just say that certainly nobody wants these restrictions in place. These restrictions are in place because they're absolutely necessary. The alternative to these restrictions is to overrun the healthcare system and result in the reading of much more Manitobans passing each day. And putting our healthcare workers at risk. So the restrictions are in there for a clear reason, for a very important reason. I think that we need to stay focused on why we have these restrictions in place. None of us like them, but they're there to protect our healthcare system for everyone who needs it.
Thank you. I also wanted to ask about the national modeling that was released today. They kind of say that the country as a whole is still on a rapid growth trajectory. And they kind of did single out the prairie provinces of having that really steep climb. Would you say that Manitoba is ahead of other provinces like Saskatchewan and Alberta in this, since we did institute Code Red restrictions a couple of weeks earlier? Where would you say we are in that mix?
Well, we're ahead on the timing of it. So Manitoba was in that position, that huge climb when we initiated our Code Red. And so now we've been able to change our directory. So we were just the beginnings of the second wave here was many weeks before some of those jurisdictions. So we were in that place. We've changed our trajectory somewhat, but we're still not in a good place right now.
From City News, Jonas.
Good afternoon, folks. Just want to touch base on kind of the. It looks like we're kind of in a changing front here in the COVID fight. That now, it's personal care homes, it's First Nation communities. I'm just wondering, is this an accurate reflection of kind of what's going on behind the scenes? Is there any reshuffling on, where the next, I guess, fight in this battle is?
I think that the overall approach to the pandemic is has been our overall goals, right? To reduce morbidity and mortality, to limit societal impact of this, and we knew right from the beginning that there were going to be very susceptible parts of our population that we needed to do whatever we could to protect. And so we learned very early long-term care facilities. We know from a variety of reasons that First Nations communities and Indigenous people could see a disproportionate effect for this. So, I mean, the overall approach is largely the same. We need to decrease our contacts. And so for certain communities, the ability to do that and what sort of supports are required to do that is different. And so we try to tailor our response to the current facets of the outbreak that we're seeing.
When it comes to the continued spread on First Nations, Shamattawa this week, of course, has been hit very hard. We've seen. Are there other First Nations that we're concerned about? I mean, we don't have to name them, of course, at this point. But I mean, are we on the precipice of of widespread outbreaks?
We're seeing other communities that we're concerned about seeing that kind of transmission again, and so so we're working quite closely with their partners, with their leadership. We have rapid response teams. So yes, there are other First Nations that are involved right now.
I guess as a follow-up on that, provincial resources, do we have enough? Are we going to see maybe, like what we saw the military coming into Shamattawa be called into others?
Well, I mean, I think it's certainly possible. We work with our federal partners, First Nation Inuit Health Branch, and have a lot of resources on the ground through the rapid response teams. We've provided a lot of support for, say, alternate accommodations as well. And so we'll continue to work with all the partners. And, I think the First Nation leaders have continued to be, fantastic leaders during this pandemic. And so we'll continue to work with them.
Our final reporter this afternoon from the Winnipeg Free Press, Julia.
Hi, good afternoon, everybody. Dr. Roussin, are we seeing more outbreaks in schools right now, and is school transmission a concern?
We're not seeing a lot of transmission within schools. If you look at if you compare it to the amount of cases we see in schools, as well as the amount of transmission we see in the community. And so we do see outbreaks in schools. We do see transmission in schools, but it's certainly not at significant levels. We see a lot of cases there. Most of them are acquired in the community.
Okay, a follow-up to that, I guess, there seems to be very little consistency in terms of how schools report COVID-19 cases. Could you walk us through what's supposed to happen after a student or staff member tests positive?
Well, as far as reporting, as far as our public health, response, when we hear of a positive case, it gets referred through our surveillance to the responsible region, and it's investigated as a case. So with these areas, we're tightly linked to education officials and the educational leaders in that school, because that's where we can find most of the information about cohorts and who may or may not be a contact. Then we have, from their decisions being made on who should be named a contact and who should self-isolate, the letters go out, and then we subsequently report on whether there was a case there or if there's an outbreak.
Thank you. And just to clarify, how are those outbreaks being reported right now? I know there was a question earlier about a delay in school outbreak reportings.
Yeah, I don't think there's been a change to the mechanism. I believe it just goes on online on the PRS. So I'm not aware of of a delay, but we'll look into it.
Great, thank you so much.
Thank you, everyone. This concludes our media briefing.